Many patients are told that when they have joint pain, back pain, shoulder pain, knee pains, that one of the only options after exhausting physical therapy and pain management with pain pills or anti-inflammatories, that the next step is surgery. Unfortunately, that also has certain risks, certain recovery time. What if there's a way to regenerate and to help your body from its innate ability to recover? This is the exciting revolution of something called PRP, exosomes, or stem cells. There are other options that you should be contacting your practitioner or having a discussion. At Progressive Medical, we look for alternatives and other options that will either delay the surgical intervention or completely eliminate it whatsoever. We are big believers in surgical intervention when all avenues have been exhausted, and that's why Progressive Medical, we think outside the box, and we're looking for innovative therapies, and we believe that a combination of PRP and stem cells could be the future of regenerating and also helping you optimize your body's innate ability to heal at the cellular level. We believe that PRP, platelet-rich plasma, and mesenchymal stem cells or exosomes are great options prior to looking at potentially surgery. What is the difference between PRP? Platelet-rich plasma is actually taking out a small amount of blood and spinning it down and separating your platelets. And your platelets offer something called growth factors, which is a fantastic strategy. And we know it's helped so many patients, not only in the United States, but internationally. It's been an intervention for quite some time, very revolutionary. And it's your own blood, so there's no opportunity for your immune system to reject it, and we strongly believe in it. However, there are some limitations. What if you don't have vibrant growth factors in your platelets? And typically as we age, we lose that ability to have that platelet viscosity, and you may not have as many platelets as well. So it really depends on your health. It depends on your age. Typically, if you are over a certain age, we believe that when you get into your 50s and possibly 60s and older, that your platelets are not as vibrant enough. And this is when we see that stem cells, your body produces stem cells from bone marrow. You have the ability to extract the bone marrow as well. Also adipose tissue. Most practitioners do bone marrow extraction, which are your own stem cells, but also if they're from your own and you are past a certain age or you have some health complications, it may not work as well. And the other option is to look for mesenchymal cells, which come from screen donor placenta from an FDA-approved laboratory. So there are some options. So the big difference between PRP and stem cells, PRP is platelet-rich plasma. These are platelets, and stem cells are from mesenchymal cells and Wharton's jelly growth factors. A combination of both or one individually, we can see a more robust potential for healing and growth and allowing your body's own innate ability to heal. At Progressive Medical, there are times that our practitioners believe that using both is a great strategy. So we do combine, in certain cases, platelet-rich plasma with mesenchymal cells. And these mesenchymal cells are undifferentiated, which means they do not have a memory from the placenta. Has to come from FDA-approved laboratory and screen donors. And the results can be revolutionary. It allows your body to innately heal and allow your body to recover. And hopefully you can avoid surgery or delay it. And this is something we feel very strongly at Progressive Medical, giving you options to be proactive with your health rather than reactive, waiting for your body to degenerate. The power of regeneration is there, and the technology is there now. The future is here now. We feel the best candidates for PRP are usually those under the age of 40 and you have an injury. There's all kinds of different types of injuries. You could have just a knee strain, torn ligament, just a stubborn injury that's not healing properly. We've seen great success, and there's been numerous research articles published on the benefits of platelet-rich plasma, and that's something that we strongly feel that you should consider if you have an injury that's not healed properly with either physical therapy or rest, and that's something that you should consider at Progressive Medical. We've seen many patients that have exhausted physical therapy, rest, and medication and anti-inflammatories, and this is something you should consider. Most of our patients, usually with PRP on its own, they're usually under the age of 50, and we feel that is a great strategy. Typically patients older, we recommend the combination of PRP and stem cells, only because you want to have that ability to heal, and it's a great combination as well. So those are the candidates that we've seen. Results are very individualized when you have PRP. Follow instruction of your practitioner, which we also take very seriously on your recovery process. It could involve certain exercises, also restraining from certain exercises as well, allowing those growth factors to do its job. Your body has this innate ability. When it's your own platelets, it can regenerate and assist your body's healing process and expedite. Everybody's very individualized, but we have seen in the past, within a week, 2 weeks, 3 weeks, the body begins to recover. So that's really exciting news, and that will allow you to get back on the playing field or back to doing your daily activities. And no one should be living with pain, and there's a way for your body to function properly, because it's all about functional medicine and functioning optimally. Stem cells are an advanced treatment, and that's an area of regenerative medicine that we feel very strongly that is not only adjunctive to PRP, it can be at times superior. There are times you can combine them together to get most optimal results. There are certain studies and physicians and practitioners using that strategy. You could use stem cells on its own. Our practitioners make that decision based on individual goals and finding out the extent of the injury and how long. If you have a patient that has a very chronic injury, or they saw one of our practitioners and had x-rays done, and we know that there's an opportunity that if you don't put these cells in sooner, that it closes the window of opportunity when it's usually osteoarthritis, which could be very, very close to bone on bone, and your orthopedic surgeon is recommending a knee replacement. 100%, we wholeheartedly believe in knee replacements and looking at hip replacements as well, but the goal is to delay that as much as possible. And this is really what can happen with stem cells. So our practitioners analyze you individually, and they're going to make the recommendation that best suits you, and it's going to help you recover quicker. And so it's very, very individualized, but we've noticed that patients typically over the age of 55 and 60 and above, that stem cells are probably one of the best opportunities to potentially regenerate and to either avoid altogether or delay that surgical intervention. And this is something that you can talk with our team at Progressive Medical that specializes, and also your orthopedic surgeon as well, because we believe in being open up front with your entire medical team. We've been involved in regenerative medicine for well over 15 years, and we've seen countless patients. We've seen at the very beginning where the technology was not that great, up until now that we've got technology, and we have before and after scans of patients that have had stem cells and PRP 5-6 years ago, and you can actually see the regeneration and spacing. That's really exciting, where you see patients that barely could not even function and walk, and now they're out exercising again. It's a game changer. It allows them to live their life to the fullest, to be active, and to fulfill their God-given goals and desires. And that's what's really exciting about regenerative medicine, whether it's just PRP, whether it's a combination, or whether it's just straight stem cells. You have the ability to allow your body's innate ability to heal, and it's been very, very exciting, and it's worth the benefit. Obviously, there's always a cost related, and stem cells could be costly. It is not covered by insurances or any type of third-party insurance whatsoever. We're hoping in the future that will be something that these insurance companies will see the benefit, and more doctors are presenting research and data. So it's something that if it's in your budget, it's well worth it, and that's something that you should plan for, because regenerative medicine is continually expanding. It's continually making strides on making it better. We also look at adding these peptides as well. So at Progressive Medical, we definitely are thinking outside the box, and we're looking for strategies to help you make a solid decision that you feel confident will make an impact on the improvement of your health. And that's what our focus is at Progressive Medical: transparency and looking at the treatments that will give you the edge. I feel very good about it. I've had stem cells myself. We've had team members also with regenerative medicine, and we've seen so many patients over the years, not only at our practices, but also other practices across the country that we go to, learning these different seminars and having colleagues all over the country talking about the same thing. It's an exciting time to be in medicine, and we implore you to do that research and to take the next step.